Good morning, everybody. I want to thank you all for taking time out of your Saturday morning on a rainy, gray Saturday to talk about hope and talk about recovery and love and light in our community. And I know that all of us and others who are joining us online appreciate us all convening this morning. For those of you who don't know me, my name is Evan Glass. I'm an at-large member of the County Council, serving in my second term. And before I go any further, I'd like to acknowledge Sheriff Max Wee for being here, an integral part of our public safety network here in Montgomery County. So Sheriff, thank you for being here and for everything that your team does. I also want to send regrets on behalf of Dr. Volkov, who has come down with the flu. And so she is unable to be here this morning, but she was extremely excited about this conversation, one that had been in the works for a number of months to get it on her calendar. And so she sends regrets, but we wish her a very speedy recovery and look forward to a future conversation with her here in Rockville in the county. Because we know that the conversation we're having today is just one of many that we need to have. And oftentimes we don't have public conversations about how we in a community can keep an open mind and an open heart to those who are struggling with addiction, how we help those who are feeling loss of a loved one, someone who might have died by overdose. But these are the conversations that we have to have if we're going to keep everybody healthy and safe. Because we know that addiction is a disease that does not discriminate. It afflicts every family, every community, regardless of race or socioeconomic status, and that is clearly true here in Montgomery County. And one of our roles in county government, in government at all levels, is to keep people healthy and safe. And that is really what this conversation is about. I want to share with you some data points to illuminate the situation here in Montgomery County. From 2012 to 2022, unintentional intoxication deaths have increased by 200% here in Montgomery County. And that is not just a statistic. Those are our neighbors, our coworkers, our families and loved ones. In 2023, we lost 136 individuals to overdose. And of those, 10 were younger than 21 years old. So this is afflicting our youth as well. And we know that harm reduction strategy is a public health strategy. And we want to reduce the negative consequences of drug overdose without requiring abstinence from drugs, because we know people are not ready to stop, but we have to help them get there. And we have to provide them with the tools. And the individuals who are joining me on the dais today are going to help unpack the situation here in Montgomery County, provide information about what we as local government are doing and what our nonprofit partners are doing as well, because this is a collective effort. In order to maintain a strong social safety net, it requires all of us to hold on. Not only hold on to that net by providing resources and information, but holding on to each other and making sure that we help those, whether they are struggling or whether they are a family or a loved one who's struggling with someone else who needs help. If you've noticed outside when you walked in, there are tables with information from the Department of Health and Human Services that is distributing Narcan and helping provide information for those who need training with it. So I want to thank our HHS team for being here and for all the work that they are doing. Last year, the Prevention and Harm Reduction team actually trained more than 6,000 people in Montgomery County on Narcan administration. More people who are helping hold on to that social safety net, helping our neighbors and our friends who are in need. Narcan is free and it is available to residents in the county. You can actually pick up Narcan at one of our fire stations. No questions asked, no prescription needed. That is a program and a service that few people actually know about, but please let others know that it is freely available at our fire stations. I'll close my introductory remarks by saying that we are experiencing an opioid epidemic across the county, across the state, and across the country. And we all have a role to play in keeping our residents and neighbors healthy and safe. The trends that we are seeing here in Montgomery County, we know that there are things that are working. And that's the conversation that we're going to have today, so that we all can do better, not only as local government, but all of our partners, to make sure that our residents are safe. And so I just want to thank all of you for participating, for joining in this conversation, for caring about yourselves and our neighbors. And so now I'd like to introduce members of the panel who'll be joining in this conversation. I'll introduce individuals and then ask for you to give a little bit more about your background and why you're here. We're going to start with Dr. Kisha Davis, who is the health officer for Montgomery County.
Thank you. Good morning, everybody. Thanks for coming out on a rainy Saturday. As Councilmember Glass mentioned, I am Dr. Kisha Davis. I'm a family physician, the county health officer, and a mom. And I am deeply passionate about substance use. I have seen how it impacts communities, how it impacts families, how has it impacted my own family. And when I started in this role just about a year ago, one of the things that really came and slapped me in the face was the increasing rise in opioid overdose, especially fentanyl, especially it was affecting our youth. And that really sparked a call to action. So I am excited to be here to continue this conversation. It's an important conversation, and just recognize the importance of continuing to spread the word in our communities. So thank you.
Thank you, Dr. Davis. Next, I'd like to introduce Avital Graves, who's a manager for the Mobile Integrated Health Program for Montgomery County Fire and Rescue Services.
Thank you so much, Councilmember. My name is Avital Graves, as he said. I run the MIH program, which basically focuses on high utilizers of the 911 and hospital systems, as well as those who may need more support than what a typical 911 interaction would offer to them. I am, just as Dr. Davis mentioned, very passionate about substance use disorder and behavioral health in this county. What we see is a disproportionate impact for behavioral health high utilizers, which includes substance use disorder, mental health, et cetera. And what we're seeing is that they often cycle through our hospitals much more frequently than those who don't suffer from these afflictions. They are pushed through a system that isn't really ready to help them or able to address their needs in the time that they need them addressed. And so what I have taken on personally is an effort to introduce the fire department into the overall cycle of helping people get to the right place at the right time. And I do that in conjunction with a lot of my colleagues sitting here at the table. So we are very passionate, and we expanded recently our Leave Behind Narcan program in conjunction with Health and Human Services and the state of Maryland to do exactly what Councilmember Glass said about having Leave Behind Narcan kits on every single piece of apparatus in Montgomery County Fire Rescue, as well as at our fire stations.
Thank you very much, Avital. Next, I'd like to introduce LaTonia Graves, who is the executive, LaTonia Rich, sorry, thank you, who is the executive director of Tree of Hope.
Hello, thank you, Councilman Glass. I'm the executive director of Tree of Hope Association, and I'm also the director of the steer team for the county, and I work with Avital and a lot of other community supports. Tree of Hope Association is an organization to support people who are new in recovery. So people come in and we connect them to resources. Our greatest efforts are to remove barriers for people who are new in recovery, in that we partner with a lot of organizations that don't normally speak to each other. So we've been really successful in removing those barriers that I know I had. I'm a person in long-term recovery. I have 23 years in recovery. And everyone who started this organization is in recovery. And we train people in recovery to help other people who are new in recovery. It's a career path, and it's a state certification, a state board. So we take what is normally a source of shame and guilt and use it to empower people and to use that superpower to help other people, obtain freedom just as they have. So so people can hold their heads up high again and walk in this community as productive members. The STEER organization, the STEER team is a opioid response team of people with lived experience. They go into the ERs at the time of crisis, and we get them into treatment. Prior to the pandemic, I think it took us 3 to 6 days. We can get someone on the way to treatment within an hour. So it's an incredible team and incredible efforts, and for people who are really important, really and passionate about others' outcomes, especially in this community. Thank you.
Thank you very much, LaTonia. And then last but not least, we'd like to introduce Melissa Cafarelli, who is a counselor with lived experiences.
Thank you, Councilmember. So I am one of those people I'm in recovery, and I want to help people in early recovery. I am a counselor at a local treatment center. I actually work at a couple local treatment centers, one being the Freedom Center in Gaithersburg. I'm also a certified peer recovery specialist, so I also work in that field of helping people in early recovery through lived experience, right? So I come from a place of understanding. I'm in long-term recovery myself, so I'm deeply passionate because I have my own experience, my own struggles with opioid addiction and recovery. I want to show others that recovery is possible, because it is. I'm impacted because I have friends that have lost their lives due to this disease, and any little help goes a long way. So I'm happy to be here, and thanks for welcoming me.
Thank you very much, Melissa. Again, my appreciation to all four of you for joining this morning. It's not lost on me that it's Women's History Month, and I'm joined by four incredibly strong women who are helping our community, and my deep appreciation. So the way we're going to continue for the next 45 minutes or so, I have a few questions to tee things up. But if you have questions, we welcome them. So at the appropriate time, we'll invite you up to ask a question at the microphone. So hold on to those questions. And before we continue, I also want to acknowledge staff from my colleague, Councilmember Natalie Fani Gonzalez's office here. Councilmember Fani Gonzalez has been going to Annapolis, working with our General Assembly and state leaders to work on laws and programs to mitigate this epidemic. And so I appreciate her being represented here this morning. The first question, I'll turn it over to Dr. Davis. What are you seeing here in Montgomery County as the chief health officer regarding overdose deaths and what we are doing as county government to help stem them?
Sure. So thanks for the question. So we are in Montgomery County seeing a trend increase in overdose in adults, really in everyone, from 2022 to 2023, and we're also seeing this trend increasing across Maryland. I think one of the groups that we often don't talk about is we focus a lot on the youth, but we are also seeing this increase in folks over 50. And that is an important group that we need to be thinking about. When we look at the data, there's an increasing trend in African Americans, and that is largely driven by African American males over 50. And so as we're thinking about our outreach, in 2023, there were a total of 140 overdose fatalities in Montgomery County, which was a 28% increase compared to 2023. Compared to 2022. Of those, 28% increase in opioids and a 29% increase in fentanyl. So quite a bit, most of the opioid overdoses are driven by fentanyl. And actually, when we look at overdoses overall, about 80% of overdoses have fentanyl on board in some way. The fatalities due to cocaine increased by about 55%, and fatalities from alcohol decreased by about 50%. On a positive note, overdose fatalities for the month of January 2024 were a total of 3. In Montgomery County represents an 80% decrease. There were 9 cases in January of 2023. 1 month doesn't make a trend, but we think that that's hopefully getting the word out there. One of the things that we do see is that the calls for Narcan from EMS were down, which could be 2 things. It could be that people are using less, which would be nice. It also could mean that there's more Narcan available in the community. And so people aren't necessarily calling EMS because they have it. Either way, I would say that's a positive, because either they're using less, great, or they know that Narcan's available and they have access to it. Either way, we hope that will continue the trend of fewer deaths.
Thank you very much, Dr. Davis. So an 80% decrease in January. And while 1 month does not create a trend, how does that stack against other months prior to that?
So at the state level, we have started to see a little bit of a trend. So that's just Montgomery County. At the state level, we saw a little bit of a decrease from like November, December, January. So we are cautiously optimistic that that we might be starting to see some improvement. I think one of the things that we are going to start doing from a county that will give us a better idea is looking at fentanyl in the wastewater. So one of the tricks that we found from COVID was we could identify COVID in the wastewater. And so as people stopped testing for COVID, we had a better idea of where it was across the county. And so we are looking at applying that for opioids and fentanyl as well, which will allow us to be able to better target where resources are. So if we're finding that there's areas with higher levels of fentanyl in the wastewater, we can target Narcan distribution kits and things into those areas.
Thank you. And we know that November, December, and January are particularly tough times for emotional health. And if the numbers are going down during those times of traditional duress, then we should be cautiously optimistic. So thank you for that information. Now we'll turn it over to Ms. Graves. Talk a little bit more about what Fire and Rescue Services does with respect to this work and how you partner with other agencies and nonprofits in the county.
Yeah, that's a great question. So Dr. Davis stole some of my thunder. She must be reading through the back of my computer screen to see my notes. We, in fact, are seeing a lower number of reported or suspected opiate overdoses, and we call them suspected because we're not doing, lab work on patients in the field to see what's in their bloodstream, right? We're not doing a tox screen on patients, so we can't be 100% sure of what they ingested. It's just that the symptoms that they're presenting with mimic that of an overdose, or we administer Narcan on scene and it works. So those numbers are going down, but like Dr. Davis said, it could be due to a multitude of factors. What fire rescue typically sees is, a situation that goes out for cardiac arrest. Overdoses are often mistaken for, someone being in cardiac arrest because the respirations are so decreased that it's hard to tell if they're breathing or not, and their pulse might slow to a point where you can't really feel it. So that's often what we go out for, and then we come on scene. We're seeing more people give Narcan before we arrive, which is a great sign to indicate that our Narcan distribution efforts are working. It's wonderful not only to see that Narcan is out in the community, but that people aren't afraid to use it. We want to remind people that there really is no downside to using Narcan on someone that you suspect may have had an overdose. If they are, for example, a diabetic suffering from low blood sugar and you give them Narcan, it's not going to wake them up, but it's also not going to hurt them. Mm-hmm. So we do want to make sure that folks are giving that Narcan if they think it's appropriate. And we also, want to make sure that we close the loop. I think a lot of our efforts in the past may not have been as effective because we would transport a patient after an overdose to the hospital, and then that was the end of the story. We had a very limited interaction with our patient. And at this point, what we do is really try to enhance the social safety net that exists around that patient, whether they're transported to the hospital, or whether they sign a refusal and don't want to go. So what we do is we actually share data with the steer team. They get a notification right after we run a suspected opiate overdose, and they have that information at their ready so that they can go to the hospital and meet the patient to offer them resources and support. They can also follow up with the patient by phone if the person refuses to go to the hospital and say, hey, we understand you had this event. Can we offer you assistance? And what that has done is really close the loop so that folks are not just, experiencing this traumatic event and then being left on their own to figure out the next steps. We also do offer leave behind Narcan on a variety of calls, not necessarily just an overdose, but we do have kits on every unit so that when we do run an overdose and there's a family member nearby who says, I just used my kit that I had, we can say, here you go, here's another one right away to have, especially if there's a refusal, because we know that Narcan is short acting and it's not going to eliminate the opiates in the system. It just mitigates them for a short period of time. So we do our best to educate family members, friends, patients on what might happen if they refuse and what signs to look for, so that they can be aware of the fact that they might need to administer Narcan again down the line.
Thank you for that. I just learned something new, that Narcan can be applied without any adverse effect, even if you are not exhibiting or you're reacting directly to fentanyl. So I think that's a really important point. And I shared that the fire stations, firehouses have this available for members of the public. I would gather that there's probably some apprehension among individuals to walk in. Can you just share with folks where they would need to go, or just give them a little boost of confidence if they want to walk in and ask for it?
Yeah, absolutely. Our Narcan distribution is completely free and anonymous. You don't have to provide any proof of residency, any ID, any insurance cards, nothing. You can come in and even if you have a friend who's not a Montgomery County resident, we get our Narcan from the state of Maryland. Our goal is to blanket the state of Maryland in Narcan. So if that includes people from surrounding jurisdictions, so be it. We can give out Narcan to youth as young as 14 years old. So we do, routinely get teenagers walking in saying, I'd like to have it, so that just in case something happens to a friend of mine, I'm ready and I'm prepared. And the kits include some collateral in there, the same thing that you'll see in the kits that you've gotten today. There's information about who to call for help. There's a pair of gloves. There's a face mask in case you need to do mouth-to-mouth resuscitations, although I will say CPR no longer includes mouth-to-mouth. A shout out to hands-only CPR. You don't have to do mouth-to-mouth on people. Please don't think that you do. But we have provided one just in case. And the goal here really is just to enhance preparedness, right? What we try to remind folks is, even if you don't think you know anyone who uses substances or has addiction struggles, the reality is you probably do, and you just don't realize it. But a lot of what we've seen is incidental overdoses, right? Where somebody comes to work and has an overdose at work, and their coworkers had no idea and weren't prepared and didn't have Narcan. We've seen, circumstances where someone comes into the house to do repair work and has an overdose, right? We've also seen overdoses happen on prescription medications. Sometimes someone is prescribed something completely legal and routine, and they suffer an overdose. So having Narcan on hand is not indicative of a stigma or a shame, that someone has that struggle. It's being prepared so that when an emergency happens, you can respond and contribute, just like learning hands-only CPR or basic first aid.
And to that point, one of the important reasons we're having this conversation is not only to provide information, but to destigmatize all of this, to let everybody know that we want you to get help. We want our loved ones and neighbors to get help too.
And we do offer, if you do want more information, you can provide a name and phone number to the firefighters that you speak with, and they will, we get that information directly to our harm reduction team with HHS, so they can follow up with you and offer you more support.
Excellent. Thank you, Ms. Graves. You talked about collaboration and partnerships in the STEER team. And so, Ms. Rich, talk a little bit more about the unique model that you all you all have, particularly with the peer support model and how that works with members of our community.
Thank you. The peer support model is a complement to the treatment model. Therapists who work in treatment centers, they focus mostly on like the history of how you got here, you know, breaking down, getting people in touch with trauma and things like that. Peer support was more concerned of what's going on with you right now, how can we help? So also the therapist also is engaged with that individual as long as that person is engaged with that program. So the benefit of peer support is peer support will follow a person across a continuum of care. So our peers, steer team, and some of the other teams that I manage, they will follow a person from detox to treatment to longer term to recovery housing to back in the community, helping remove barriers that an individual would have to figure out on their own. Finding meetings is relatively easy because treatment centers help with that. They bring meetings into their facilities. But what about filling out entitlement paperwork? Filling out job applications that they hadn't done in a really long time, or being connected to workforce development where they gain skills that can make them employable and make a living wage. In our facility, we have a nurse there. They're there 2 times a week to see people who are transplants from other areas. People come from Baltimore and they got medication from the treatment centers, but now they don't have a doctor here and it's a 3-month wait as a new patient. So we try to remove barriers as a peer community. So whatever that barrier is, we try to meet people where they are and make sure that they're whole. Our goal is not to have them come back again and again and again, or be in our facility for years and years and years. Our goal is to make an individual whole and motivated and confident enough to stand in the community to be a productive member of society where they don't need us anymore. And we use that through lived experience, right? It used to be that the relationship a therapist had with their clients would be different than up here, but now because of people like Melissa, a lot of people who are coming into the field have lived experience, so the lines are a little more blurred now, which I think is a good thing. When I went to treatment, I went to Avery Road, and a lot of times I saw therapists that I knew only knew me by reading a book, and you could feel it. But the therapists that were there that actually have lived experience, they didn't have to tell me they had lived experience. I could feel that they knew exactly what I was feeling at that time, and that's all I could connect to. And it's kind of unexplainable, but knowing peer support is not a new thing. You know, we use it with cancer patients, we use it with veterans. There's nothing that can replace a person that actually knows your pain, right? To make that connection. So it's been a really amazing journey watching peers train, go out in the community and watch people just flower. You know, it's so esteem building. It's so esteem building to watch a person that has blown their whole life up, you know, come through treatment and obtain a position that they were so ashamed of. You know, what they were so ashamed of be the thing that empowers them to go out and just be this superhero. You know what I mean? I have to bring them down a lot of times, right? Like, you're not actually saving lives, you're creating opportunities, but that's it. They go out and they create opportunities for people to save their lives in a non-judgmental way, no matter how many times it takes them. You know, every time they come, you know, there's another opportunity created for that individual. And it's really important.
I love it. I love it. And Ms. Rich, can you share with us and everyone who's following the conversation how they can contact you and learn more about the organization?
Most definitely. We're right down the street. We're at 30 Courthouse Square. Our website is treeofhopeassn.com. It's a drop-in center, so you can drop in anytime. You don't have to make an appointment, and someone will give you a tour and give you a breakdown of all the things that we do. We're also an ORB. We're an opioid response program, so we have Narcan, fentanyl testing strips, Silazine strips. You can come in and no questions asked. We also have HIV home testing kits that you don't have to ask for. We just set them out in the front. And if you grab one, I don't care. I don't see you. You know what I mean? So we try to make sure that whatever barriers that people in our community are experiencing, we try to remove them and make people feel as comfortable as they can getting the help they need, whether they have to ask for it or not.
Beautiful. Thank you.
You're
Thank you.
welcome.
And then, Ms. Cafarelli, you shared up front about your lived experience and your determination to help others. And so we have a room full of individuals who are here because they want to help. And so can you share some advice that you sometimes give to people that you counsel and to those in the community?
So it's hard, right? It's really difficult to have a family member, a loved one that's struggling with the disease of addiction. I think my biggest piece of advice would be to take care of yourself, first and foremost. Truly, just as people in addiction were powerless over drugs and alcohol, our loved ones are powerless over us. So they need to seek help themselves, whether that be through therapy, their support groups. Just as, addicts in recovery, we have 12-step programming, so do our loved ones. There's 12-step programming for our loved ones as well. So that would be my biggest piece of advice. I just like to add that, sometimes we like to think, you're watching someone that's struggling with addiction, and it's hard, right? And we see them struggling, and I feel like a big thing that we think of is like, they're choosing the drug over me. They love that drug more than they love me, and that's just not the case. It's just not the case. And we have the disease of addiction, and we have blinders on. We don't see that. We don't want to see that we're hurting other people. We don't, and that's where the shame and the guilt comes into play. And how do we not want to feel that shame and guilt? We use more, and that's the cycle of addiction, So when we talk about breaking down barriers, that shame and that guilt, that feeling fuels us back into active addiction. Truly it does. So breaking down these barriers, being there to help the person, not looking down on them, That's why I think peer support is so incredibly, important, because, I used to work at the STEER program as well. I was an overdose response team member, and when we would get these phone calls, we'd show up at the hospital, and these people just overdosed. They're in the hospital. This is the worst day of their life probably, and they're looking up at somebody that's been there before. I've been there before. And it's different than maybe a nurse or a doctor saying like, you need to go to treatment, It's somebody that has been there before, like, hey, I've been where you're at. I know it's hard. It really is very difficult. But we don't have to live this way anymore, I've been there, I felt that. I don't live that way anymore, you don't have to. And that's the really cool part about peer support and just having this lived experience, because addiction is hard, but recovery is possible,
Thank you for sharing that. This is a conversation about hope and help. And can you just share a little bit more about your journey going from addiction to helping those with addiction?
Sure. So we talk about in the community, I guess, hitting your rock bottom. We talk about hitting rock bottom, and for me, there was many bottoms, to be completely honest. There was many bottoms for me. It had to get bad for me, and I think, I've been in car accidents. I've been in opiate withdrawal, which is not pleasant whatsoever. And what it really took for me is I became somebody that I didn't know. I was going against all my morals and values, all I held to be, core beliefs that I grew up with. I was going against all of that, and I just didn't I didn't want to live that way anymore. I didn't want to wake up sick anymore. And I knew there was help. So a part of my story is 12-step programming and treatment, you know. Again, I talked about many bottoms. Relapse is a part of my story. Like, I've relapsed many times and went back to treatment or went back to 12-step program. And through that process, I've met people that have lived experience. I met people that have been where I was and now live this beautiful life, and I saw hope, you know. So I think that's why I do what I do, you know, to show that there is a solution, right? There is recovery possible, because that help was provided to me.
Thank you for your honesty and for turning your struggles into positivity and helping others. I welcome anybody who has any questions that you might have up to the table, to the side, to ask. Yeah, if you want to. Oh, David has a mic, so maybe sit down. I did not know that we had the microphone. I see all these mics up here. So yeah, so David or Hope, if you want to walk around, and we can take some questions for the next 10 or 15 minutes.
What's your first question?
Yeah, so good morning. First of all, Council Member, thank you very much for bringing us all together and for the terrific panel that you put. So I am a resident of Montgomery County for over 30 years. My name is Christina Rabadan-Dio. I'm a scientist, a public health professional, but also a mother who lost her son 4 years ago due to an accidental opioid overdose that contained fentanyl and psilocybin. So before I have one comment and one question.
Sure.
And before I do that, I wanted to congratulate you, Melissa, because a lot of what you said about how you felt, that's exactly what my son felt. You know, he felt shame, and that was unfortunately one of the reasons why he never identified himself as a person who had a disease and never wanted to go into treatment and recovery. So one comment that I have, and I want to commend all the efforts about Narcan, I would like to see a little bit more of a targeting effort on the distribution and education of fentanyl and psilocybin test strips. We do know that President Biden last year declared psilocybin as a national emergency threat to our drug supplies, first ever in history. We do know that Narcan is less effective when psilocybin is present. However, we have to continue, please, to administer Narcan, but we need to start educating the population. And I see a lot of efforts going into Narcan. I don't see that many efforts on fentanyl test strip and psilocybin. So we know that the federal government allows now federal funds to be spent for not only the purchasing, but also distribution and education on fentanyl and psilocybin test strips. So please, let's remember that many of the people who died of an overdose died alone and had fentanyl and psilocybin tested strips available, we could have saved lives. So my second, and this is now a question, is you mentioned something, Council Member, that it really struck home, which is this disease is a disease that doesn't discriminate. And that is very clear. We've seen it all over, we see it in the nation. And although it doesn't discriminate, it also, there are a lot of inequities within this disease. So I've been in my last 40 years of professional experience as a scientist, a public health professional, working a lot with underserved populations, and particularly focusing on the Latino Hispanic community. We know that about 20% of our county is Hispanic and Latino. We know also that a lot of our adolescents that are dying are from Hispanic or Latino heritage. So what I don't see is a lot of dedicated and strategic efforts directed to that community. And I'm working with a lot of those people, you know, trying to develop programs, not only education, but also harm reduction, that are language and culturally competent. Could you please talk about what are the efforts that are you doing, trying to reach out those needs, specific needs in our underserved populations in Montgomery County, but in particularly to the Latino Hispanic community? Thank you.
Thank you for being here this morning, Christina, and for channeling your son's memory into this effort. I'll turn it over to Dr. Davis to talk more about this, and I'll preface her response by saying, I served on the Health and Human Services Committee during my first term on the council, and one of the most illuminating aspects of that work was seeing the heat map of Montgomery County and seeing where the need was with regard to health care or transit access or food insecurity. And unfortunately, the heat map is pretty similar for a lot of these communities. And I'll turn it over to Dr. Davis to elaborate a little bit more.
I'll address your question, and I think Ms. Graves also will comment on some of the xylazine efforts as well. And so it was interesting when the increase in opioids, when I started in this position about a year ago, we were just starting to see the increase. And the way that Maryland and the CDC released data, it's suppressed if it's under 10 people, which means you can't see race trends when the numbers are small. And so we initially didn't see that there was a rise in Latino youth. And the way that we saw that was because we heard from the community, and community reaching out and saying, we're seeing this as a problem in our community. And in response to that, we've worked closely with the Latino Health Initiative around communications campaigns. There were some ads that were on regular radio and Spanish language radio as well, targeting folks to resources, talking about Narcan, talking about resources. The Latino Health Initiative also has a program for training promotoras, community health workers, specifically targeting the Latino community. They've all been trained in Narcan and now carry Narcan to be able to distribute to the community as well. We also were looking in targeted communities and seeing that many of the street outreach workers that we had that worked directly with youth in community didn't speak Spanish. And so we've worked and partnered with Identity to put folks on the street who do speak Spanish so that we can do that direct targeting towards communities that speak Spanish and it may not have had that interaction. So is it enough? No, but certainly we are working in that direction to be able to better meet the need and know where the need is. One other thing that I'll say about xylazine, the state of Maryland has a program, the syringe exchange program, and when they get those syringes, they are able to test them and see what other substances might be there. Montgomery County has its own syringe program, but we weren't part of the larger state program until just recently. So just in January, we joined that program. The benefit of that is that now we'll be able to see what other substances are in our syringes. So the state actually, towards the end of the year, was starting to see a decrease in xylazine in syringes. They test a very small number, and they weren't testing any in Montgomery County. So that data should start rolling out in the next couple of months to have a better idea of what that looks like. Xylazine will also be included in the wastewater data to try and get an idea of where it is across the county.
I wanted to add that we do put fentanyl test strips in every Narcan kit. So they are included. I think the struggle that we see, and I don't know the specifics of xylazine test strips, we've ordered those from the state, but there was just a backlog and a delay in shipping. But what we've seen on the fentanyl ones is it is probably the most convoluted test strip I've ever seen in terms of a standard way of, you normally see a test and you think one, line is negative, 2 lines is positive. It's the opposite for fentanyl test strips. And if the left line shows up, it means negative, but if only the right line shows up, it means you did the test wrong, and the results are inconclusive. It also is really challenging to get an accurate test because the way that fentanyl makes its way into these substances, it's not consistent, right? It's not made in a pharmaceutical lab where everything is tested. It's made somewhere else where we don't know what's going in, and so if you test the wrong part of the pill that you've crushed or the bag that you've gotten a hold of, you might not get a result of fentanyl, even though there is fentanyl in that substance. You just tested the wrong part. So I agree with you that fentanyl test strips are a good public health effort. I think they have a long way to go in terms of being more effective, easier to use, easier to understand. We have looked at other major metropolitan cities for how they have educated the public on how to use fentanyl test strips. New York City has done some really great giant posters for how to use them, but it's still like you got to stop and read it and like go step by step to understand what you're working with. So I think there's a lot to do in that arena, but we do put them in every Narcan kit. So they are available and readily accessible to hand out. Same with xylazine. And we did work with Councilmember Fanny Gonzalez's team specifically around opiate overdoses in the youth Latino population. We had extensive conversations about how we could improve our outreach efforts. We make an effort from Fire Rescue every time we do a Narcan training or distribution to send a Spanish-speaking member so that we can ensure that we'd have that coverage. Today we're at Northwood High School for the Girls Summit, and we're doing Narcan distribution, and we have Spanish-speaking folks there to make sure that we are spreading the message and sharing relevant information. So we hear what people are saying. We try to pivot as quickly as we can, and HHS has created every collateral in the Narcan kits in Spanish. We are working on getting English-Spanish together so that everything has the same one, so we don't have the wrong kits being given to people who don't speak the language that the kit is in.
I just wanted to add that, we have xylazine in our office too. We had a really difficult time when they first rolled it out. I think there were so many requests that they were overwhelmed. But I actually drove to Baltimore to pick up my own xylazine. Right, I wish I would have known, but we don't put them in the kits. We just give them out when they're asked for because we have a limited amount, but we do have them. The other part I wanted to throw out, just in case anyone is interested, we've been in dire need of a Spanish-speaking peer. I truly want our peer team to reflect the community, but I've had a really difficult time identifying a Spanish speaker that is interested in doing peer work. I'll train you for free. If you're in this room, just come and see me. Thank you.
Thank you all for that. I'll close that question by answering the comment I made at the beginning about the heat map. Here in Montgomery County, the areas where we see the most need for most services, if you're visualizing a map of Montgomery County, it starts in Gaithersburg, the east side of 270, over through Montgomery Village, down through the Aspen Hill greater area, and then dips down to Silver Spring and Tacoma Park. And so that's the arc where our greatest need on almost every social service and healthcare issue is in Montgomery County. And as Dr. Davis mentioned, during COVID, we created programs specifically for the Latino community to get vaccinated. And as a result of that public information campaign, the most highly vaccinated community in Montgomery County, which was already one of the highest in the country, was the Latino community. So when we do the outreach, provide the information, people listen and act. So thank you.
Hi, thank you so much. My name is Elise Grossman. I am also a public health professional, and I'm the chair of the Montgomery County Alcohol and Other Drug Addiction Advisory Council. It's quite a name, AODAC. We advise the county council and the county executive on issues surrounding alcohol and substance use. I just had one question, probably more for Dr. Davis. We've talked a lot about harm reduction techniques, what to do with the treatment aspect, the recovery aspect. What about prevention before? We know that like $1 spent on prevention saves $7 with treatment. There's a lot of things that can be done early. What is being done in the county from that perspective? Also looking at drug supply, like where drugs are and how to stem that so we don't have to have problems later.
Thank you for the question. We've really tried to take a public health three-prong approach. And so you're right, we've talked a lot about the secondary prevention and harm reduction and tertiary prevention in terms of Narcan, but we haven't talked a lot about that first bucket of prevention. And a lot of our efforts there have focused around education and targeting youth. So we had a program in schools, Botman Life Skills program, which really focused around peer interaction and resilience, not just don't use drugs, but like how to identify risks in your friends and in yourself, and kind of broader on mental health. That program was only in a few high schools. Part of what we're using our opioid abatement funds for is to expand that program to all high schools as well as to stretch into middle schools. We've also done resources available for families and how to help parents have the conversation with their kids. What we find is parents don't know how to talk to their kids about drugs, and so helping them have that conversation. And for parents who have gone through that training, the craft training, we find that they are better able to talk their kids into treatment. So you are absolutely right. As we're working on the prevention piece, trying to help people have the skills, there's a lot more work that could be done to keep drugs out of our communities. They are there, and it is prevalent. Councilmember Fanny Gonzalez was in Annapolis this week to speak just specifically to that issue of what we can be doing to help keep drugs out of our community and what the penalties are for having it and how we can help support people along the way.
And Elise, thank you for your leadership on one of the county's 92 different boards, committees, and commissions. For those of you who missed the long name, it is the Alcohol and Other Drug Addiction Advisory Council. Maybe we'll change the name in the future to make it simpler, but it is another way for any of you to get involved in the policy making and recommendations for all of us here in Rockville. So Elise, thank you. I think Sheriff Wee has a comment.
Thank you, Councilmember Glass. I want to thank you and your staff as well as the panel members for hosting today's event. So from a law enforcement perspective, I do want to remind everyone that if you or your families do encounter any type of overdose issue or any concerns, there are bystander laws that protect prosecution. I don't want the fear of calling for resources, 911, and the fear that maybe law enforcement might be encountered. You know, our goal is to save lives, prevent tragedies, and provide opportunities for future. So I just want to make sure if anyone was unaware that please don't let that be an obstacle.
I think that's a wonderful point to raise, because in addition to that, the anonymity of access signals that we want people to help. We want them to get the items and the resources, but they also to call in and ask for help when needed. So thank you for elevating that.
Thank you so much. My name is Will Mohan. I'm a director of the Senior Reach program, which partners with Montgomery County Council to provide resources to seniors to safely age in place in Rockville. And I really appreciate the talk, especially the emphasis on the lived experience, peer-to-peer component. And I also naturally, I guess, was interested when you talked about the 50-plus demographic that is experiencing these kind of things. So I was wondering, are there any resources particular to seniors, and what would be the best way to kind of integrate this information into the program that we run?
So I think we're early. I think to be honest, there's a lot more that we could be doing for our senior community in terms of education, in terms of distribution. I think in some ways it's hidden, and there aren't a lot of places and spaces to take them into recovery. We've pulled our aging and disability folks into the conversation at HHS, but when you think about recovery spaces and places, they often won't take folks who are medically complex. And so trying to have resources available for people who may have more medical conditions that happen when we're aging to also be able to be in a treatment facility is a challenge. And our focus has been a lot around education and really just trying to get the word out to folks that this is an issue. I think it in a lot of ways has been silent. And we're trying to shine that light on it now.
From the recovery community in general, we've seen that nursing homes are reaching out for 12-step meetings, so the call has been expanded. I don't think like the conversation, is any different than it's ever been. I think maybe Like we get a lot of overdose EMS calls for nursing homes. So those we don't respond to because we figure like maybe there's a medication issue or something like that, and it's not on our purview. But we don't differentiate between a 30-something-year-old or a 50-year-old. We try to connect them to recovery resources based on what they need. There's a center in Olney. There's a Center for Successful Aging, and that program at that hospital kind of does wraparound services for people who could possibly be in recovery. So they refer people to us, but they also they have a social worker that works with them to make sure that they have adequate housing, that they have nursing care. There was one gentleman that had Alzheimer's who had like 40 years in recovery, but because of his Alzheimer's, he forgot. So he kept drinking, right? So they had to put like resources up for that individual. So I think it's a case-by-case basis, but I don't think it's a different conversation from a 30-something to an older person.
Yeah, we have been partnering with long-term care organizations. One of the questions that we had in fire rescue is, do you have Narcan? And the answer we got from most places was, well, yeah, but when somebody is prescribed an opiate, right? So we carry it in conjunction with their prescription, but we don't have it on hand. And so we work to, get in touch with the medical directors at those facilities to say, can you keep Narcan on hand just in case? Because we are seeing medical overdoses, right, related to prescription medications and medication errors. But we're also seeing substances come into the nursing homes by different ways, and people are overdosing on illicit substances in nursing homes. It's not common. It's not to the proportion of what's happening in the main community, but it still needs to be addressed and can often have much more serious ramifications for someone who is older and has existing medical comorbidities when they overdose on a substance. And you get into complex factors with, do not resuscitate orders and things like that. So we're very aware of it, and we work with the Area Agency on Aging. We work with the different, aging and disability. We have an adult protective services nurse on my team. So we work very closely with our elder community members, and even places like Charles E. Smith Life Communities. We've done trainings with them for Narcan and kind of educating folks and social workers in the general aging community around how to help and how to direct people to the right resources. But I agree with everyone else. We need to do more.
And Will, thank you for raising that question. I've been told that there's actually a nursing home that is on our live stream right now following this conversation. And we are live streaming on the Councilmember Evan Glass Facebook page, so you can go back to that, share that with your networks as well. It's all going to be recorded there. So, Will, thank you. I think we have time for one more question, recognizing we want you to spend the rest of your day, but we will all be here after to engage if you have any follow-ups.
Good morning. My name is Betty Javdan, and I'm one of the founder of organization called Rise and Flourish. We have been in Montgomery County for the last 10 years, and since 2017, we have been in middle and high schools taking our speakers who are people in recovery to share their story with the kids and educate them about the disease of addiction. And this fall, it's just amazing how many schools that they have not been inviting us. They are starting inviting us, and we go to 3 to 4 schools during the week. And there is a need also for more speakers, but the reason that I wanted to bring this up, I just heard in Collaboration Council that Montgomery County is trying to bring in a curriculum to allow us to go to elementary school. And that is very important because up to now, they have been not letting us to go. And last week, we had 2 6th graders reaching out to our speaker and letting them know that they are addicted after listening to our speaker. And with marijuana being free right now, a lot of parents are using at home, and we have students who are reaching out to our speaker and letting them know that the parents are using it, and it's becoming a big problem. So my question is, what can you do to get us more as fast as possible to elementary schools and let the kids hear and be educated about the situation and how they can prevent themselves to becoming addicted? Thank you.
Thank you, Betty, for your work and for that question. And the question was recognizing that this runs across all ages, and we alluded to the older. We answered a question previously about the older end, and you're asking about the younger end. Anyone have any other comments about that?
I think, the challenge is always the stigma, right? And saying, well, if you go into elementary schools and you talk about substance use disorder and addiction, you're going to prime their little minds to think about it, and now it's going to happen, right? And that is a very big misnomer, right? We know that talking about things does not make them happen. If we did, I would will $1 million to appear right in front of me right now. So, we don't have that ability to simply, put ideas in people's minds just by talking about them. I think the more we talk about them, the earlier, the more we can help kids understand what they're looking for, in their friends group, in their classrooms, things like that. And, we have seen overdoses happen at the schools. It's unfortunate. Thankfully, it's rare. Thankfully, MCPS is very well equipped with Narcan now. They allow students to carry it. They have it in all the nurses' offices. They are very well trained and knowledgeable about what is going on in the schools, and they're not hiding from it. They are confronting it, up front. I think the downside is, that lower barrier of 14 years old for kids to carry Narcan. Understandable, but it's a challenge. And so I think we just need to have those conversations, as uncomfortable as they may be, to prepare kids and parents.
One last thing I'll just say about, the partnership with MCPS. They have been a very strong partner, and I know that they are looking at things about how they incorporate this into their health curriculum for all ages and stages, and how to have age-appropriate conversations around drug use. And that was also why it was really important to have Narcan in schools, in the health rooms, at all schools. And so Narcan is available at elementary schools, at middle schools, at high schools, and that education for the nursing staff and for administration has happened at all levels. And many of the conversations that MCPS has helped to foster are family fentanyl forums, like the Girls Summit that's happening today, make that conversation really accessible to everybody.
I just wanted to add, Betty, that, I've watched Betty do work in schools for a really long time. And, whatever progress that we've made has been through the advocacy of the people we've already served. So that's kind of where your niche is going to come from. Like, go to those schools that you're already in and have them advocate for you to expand your services into other schools. That would probably be your quickest route to growing your business, to growing your services across to more schools. Okay?
Thank you. I've been asked to make an exception with one last question, so we have one closing question in the back.
Good morning, everybody. Thank you, panel, for being here, and Nick, thanks for the invitation. Hope, thanks for the invitation. Hi, Miss Betty. So I work with Miss Betty's organization as well, and I'm the prevention program manager. And I just wanted to tag on to what Miss Betty asked. From personal experience, I came here as an immigrant at 11. It was a divorce, and I landed at Richard Montgomery at the age of 13 or 12. In ninth grade, I was a straight A student. By 13, I discovered alcohol. By 16, I discovered drugs. And I was late to that party. Many of my peers were doing alcohol and drugs in single-digit ages. So just to share, piggyback on a couple of shares, I did call 911 on myself on my sobriety date. That was almost 9.5 years ago, and I've been sober ever since. And the Montgomery County Police did not charge me with anything. I had a lot of drugs that day. And last week we were in a middle school and 7 of the students were suspended for eating edibles. One of them ate so many she was asleep for 4 days. She's 11. She's Latina. And and that's a 6th grader. And the 6th grader sold it to her. Where's he getting edibles, right? And I think a lot of this comes out of the households. You know, there are parents who think that, well, if they give them alcohol at home or drugs at home, that's the best solution. But unless you plan on chaining your kid to the radiator, they're going to get out of the house and then they're going to be doing opiates and fentanyl and everything else that we're dealing with right now. So I just want to put it out there that it starts at a very young age, and a lot of it comes from divorce, broken families. I had a single mom, and she had to choose which child to parent, and I wasn't it, you know. So I had to raise myself at 11, and that's where my addiction came from. So thanks for your time.
Thank you for sharing your story. And there are a lot of societal issues that start when kids are really young. And we, here in the state of Maryland are trying to help across the board, not only within our schools, outside of our schools, but that's where our social safety net comes in. And here in Montgomery County, we are blessed because of our residents' needs and demands to have an incredibly strong social safety net. I'll put in a plug and say this upcoming week, the county executive is going to introduce the next budget for FY25. I expect it will probably be around $6.9 to $7 billion with a B. And let's take a look and see what programs are in that budget to further support this work and further support the need. I invite you to be a part of that conversation. Stay in touch with my office and with me so that as we go through it, and Dr. Davis and I were talking about the budget before we came to the dais and what we can expect to come from it. But that is where your voices can be heard even further, not only within government services, but within our nonprofit provider support system. So let's continue that. Make sure that you either get my card or share your email so that we can stay in touch. And again, centering ourselves in this conversation today, the CDC says that nearly one in 3 individuals who have opioid overdoses are with someone else. They are not alone. And we need to make sure that Narcan is available, that people feel comfortable calling 911 or non-emergency numbers, that they do go to our firehouse and stations to get the support that they are entitled to, and that our nonprofit partners are there for them too. And so all of that information is available. Let's stay in touch. But I do want to extend some very dear thanks to my team. In particular, I know David and Hope and Joy and Molly and Hannah and Valeria, but in particular, there are 2 people I want to thank, and one is Agnes Lesher, who many months ago, wanted to have this conversation. Her deep work in Montgomery County and in the health and human services space is widely known. So Agnes, thank you for your dedication to Montgomery County. And then also Hope Klein. Where are you, Hope? So many of you know Hope. You've been receiving emails from Hope. I am blessed to have Hope on my team. And I'm really excited to say that next week will be Hope's 5th anniversary in recovery. And so that is awesome. She's too embarrassed to stand up, which is why we love her even more. There she is. So thank you all for joining us on this Saturday morning. Your love and dedication, not only to your family members, to your neighbors, and to yourselves is why we're here. I want to thank our panelists for the work that they do. This is ongoing work. As I mentioned, let's take a look at the budget and see how we can further this work. But in the meantime, have yourselves a wonderful Saturday, and we'll all be sticking around if you have any questions or comments. So thank you all, and have yourselves a good weekend.